Remember when COVID-19 vaccines were as elusive as your car keys on Monday morning and harder to snag than Rolling Stones tickets? The jabs started rolling out to more people in February and, after a slow start, California has clocked an impressive pace. On February 16, according to state data, just 6.3 million doses had been administered, mostly to health workers, the elderly and those at high risk of complications. 3 months later, 36.5 million jabs have entered arms, an increase of 30 million in just 3 months. To date, a solid majority of Californians 12 and older, 62.5%, have had at least one shot, according to data from the California Department of Public Health. That's better than the nation as a whole, where 61.6% have been jabbed, according to the U.S. Centers for Disease Control. We spend a lot of time focusing on, it's not good enough, but the fact that we are where we are right now, we wouldn't have expected this a year ago, said Richard Carpiano, a public health scientist and medical sociologist at UC Riverside. We should celebrate that. The more people you can vaccinate, and the faster you can do it, the better. Andrew Noymer, an epidemiologist and demographer at UCI Irvine, agrees. If you would have told me in December that on June 1st we'd be where we are right now, I would have said, Yowsa. Yeah, that's praiseworthy, Noymer said. But the vaccination pace is slowing. Southern California's inland counties lag behind their coastal cousins in vaccine uptake. While clearly making progress toward herd immunity, where the virus essentially fizzles out for lack of new hosts, which experts expect if and when 70% to 90% of everyone is vaccinated, reaching millions of people who can't or won't be jabbed yet is proving a heavy lift. Right now, we still get a passing grade, but it's like the barometer is falling, Noymer said. That means a storm is coming, but not that it's raining right now. The push now to vaccinate younger people in wealthy nations is harshly criticized by poorer ones that don't have enough vaccine to protect their healthcare workers and elderly. The ongoing vaccine crisis is a scandalous inequity that is perpetuating the pandemic. More than 75% of all vaccines have been administered in just 10 countries, said Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, at the opening of its international meeting on Monday, May 24. There is no diplomatic way to say it. A small group of countries that make and buy the majority of the world's vaccines control the fate of the rest of the world. The number of doses administered globally so far would have been enough to cover all health workers and older people, if they had been distributed equitably. We could have been in a much better situation. According to state and county data, among those eligible for shots in California, the percentages are for people 16 and older, except for Riverside County, which includes those 12 and up.